Are you a dental hygiene student who's struggling with the difference between chemo and radiation and what to do for a patient? Open up your textbooks and let's talk about it. Today, our sources are Preventing Medical Emergencies in the Dental Clinic, Chapter 10. So, chemo is going to be a medication that travels through your bloodstream. So it's going to be either taken orally or an IV. Chemo is chemical, so it's throughout the whole body. We call that circulation, right? Chemo circulation circulates through the whole body. Because it circulates through the bloodstream, it's important to check the blood count. What is the number that the blood count must be? If you said, you are correct. Radiation, you can think of literally like us taking x-rays. It is localized, right? So it's going to be localized to one region of the body. Radiation region, it's localized. Basically this big machine that kind of has all these beams coming at you, high energy at that tumor to get rid of it. That's like an external beam. There's also an internal beam that gets inserted inside for certain cancers. It's a radioactive material that gets placed inside, and that is called brachytherapy. With patients who are going through radiation, you want to know that radiation can damage salivary glands, right? The ones that multiply constantly, having very young cells. So this is going to be salivary glands, bone marrow, bone, and mucosa. So because the salivary glands are going to be damaged, what's going to happen? Xerostomia, right? They're going to have dry mouth. And with dry mouth comes caries. And there's also mucositis and osteoradionecrosis, which is dead bone, right, after an extraction or trauma. Oral hygiene care is always encouraged. Make sure they have fluoride trays and saliva substitutes, right? You want to try and avoid any extractions or surgery if it's, radiated bone already, because then it can have that risk of the osteoradionecrosis. You can have them even suck on sugar-free gum, or not suck on, but have sugar-free gum or sugar-free lozenges. It's also very important to have them come in for regular dental treatments. And then back to chemo, we were talking about how it circulates throughout the whole body, so we need to be careful with blood count, right? There is risk of infection with neutropenia or thrombocytopenia, so delayed healing. You need to avoid invasive care, so excessive, extractions or deep scaling if counts are down, lower than 50,000. Watch for mucositis or ulcerations and fungal infections. A really important thing to note before any cancer therapy starts, have them get a full dental evaluation. Remove any hopeless teeth beforehand and make sure they optimize hygiene. It's very important. During chemo, only emergency care if blood counts are safe. All other elective care, can defer that. During radiation, you want to make sure that hygiene preventative care is always prominent. Avoid surgery in those radiated areas. After therapy, make sure you have ongoing prevention of care and make sure you always have a physician clearance. Anyways, I hope that helped, and I'll see you later. Have fun studying. Bye.